Hey guys, and welcome back to our video training series on identifying and treating structural dysfunctions that may be causing our clients chronic pains. In this video, I want to talk to you about one of the more common scenarios we may see show up in our offices, discuss the symptoms that may present from our clients, and look at what pattern they may be a part of, break that pattern down into some of its core individual restrictions, look at assessment and the treatment for each of those. So this pain pattern is going to be one that will often present from our clients with, they'll describe just a chronic tightness across the low back bilaterally, kind of the lower lumbar through SI joints, and they'll oftentimes just kind of put their hands back here and say it hurts or it's really tight all along here. Commonly, they may put their hands initially right here around the L5 and top of the sacrum. It could describe that there's sharp pains there. They might describe achiness bilaterally in both hips, like piriformis area. So we've got oftentimes a combination of complaints about tightness, stiffness bilaterally, pain, discomfort. If there was an epicenter, they'd probably put their fingers right towards the top of the sacrum, base of the spine. So this pattern could have up to 5 different elements, and we're going to look at the first 3 of those. Element number 1 that we might find, and would be the first to treat if we do, is that both iliums, or the pelvis on both sides, does not want to rotate posteriorly. So I'll demonstrate in a moment on the table how we assess posterior micromotion rotation. But if we look at it just from a static perspective, we can look at it from the standpoint of a pelvis that's kind of stuck in anterior rotation. In addition to that, this pelvis is going to lack the in-range micromotion of rotation in the transverse plane, like this, and that's going to be bilateral. And the third element that we'll look at today is that the sacrum is going to lack the ability to move inferiorly. So we just think about the sacrum moving as we go into a posterior tilt. The sacrum itself has an inferior motion, so downward motion. So those are the 3 elements. I'm going to demonstrate now the assessment for each of those and the simple treatment as well. So Angelica, if you'll come out here and lie face up to begin. Okay, so that first element that we talked about just a moment ago was the ilium. Each ilium is going to lack posterior rotation at in range. So remember, we do a recoil spring test. So the first thing I'm going to do here, I'm just taking the palm of my hand and as much surface contact as I can get through the from the base of the palm through the center of it, starting out with pressure kind of cupping right under the ASIS, and then laying the rest of my palm down at the same angle that the ilium curves from there. And now I'm going to gently take up the slack. It wants to stop about right there. And if this motion was blocked, so I've taken up the slack, that's the first part of the test, but then we spring it, right? So we do this subtle little spring, and is there movement there? So in her case, she does have movement, but for the purposes of demonstration, we'll just imagine that I tried to spring and it's like pushing into a wall. There's no extra movement after I've taken up the slack. And if this was the pain pattern that we discussed in its entirety, then we'll have the same restriction on the other side as well. So the treatment for this, we're going to take the leg and we're going to bring it up at an angle as if we're trying to bring her knee into her armpit. So just going to gently take up the slack, go to right there. That's where I feel a definite resistance in the tissues. I'm not going to push through that barrier of resistance because I don't want to overstimulate the nervous system. We want to give a gentle nudge, just take the body to its initial barrier of resistance, and then we're just going to hold and wait. And so this would typically be a 2-minute hold that we would do before we will reassess. Now with this particular technique, it's very common as the body begins to release that we'll suddenly get extra movement with no extra pressure. The knee will just begin going closer towards the shoulder as whatever was blocking that motion of posterior rotation of the ilium begins to release. So after 2 minutes, we will come out of that, and then we would recheck and make sure that motion's there. Typically, the prescribed timelines are sufficient for most people, but sometimes we need to retreat. So that was the first part of the pattern that we're going to treat. So I'll have you turn over now. The second part of this pattern that we'll find is that the pelvis does not want to rotate at in range in the transverse plane. So it lacks that springiness there, that extra little motion that should be in the system if everything is moving the way we'd like it to. So for this, I'm just going to take the base of my hand and place it right along, find the PSIS, and my angle is about 45 degrees angled downward. So I'm going to take up the slack and then give an extra little spring and see if there's motion there. And if there's no motion when I do that gentle extra spring, if there's no motion on this side and this side, I know I'm still working with that same pattern. And the way we're going to treat this is, I've got 2 blocks here, foam blocks. They're about 2 inches each in height, and I'm going to put one under her ilium on both sides. And we'll come down. And this would be a 2-minute treatment before we recheck. So let me explain for a moment while this is in place what this is doing that relates to the rotation of the pelvis in both directions. With this pattern of anterior ilium fixation, one component of that typically is that the pelvis wants to sway forward, and as it sways forward, that will begin to restrict that in range of rotation in both directions. So by blocking her under here for 2 minutes, we're giving whatever is resisting her pelvis having a more aligned relationship with her torso to unwind, and then after the 2 minutes, we'll take those blocks out and recheck. So take them out. Make sure that was enough time. So it's just a simple recheck both sides. Takes just a couple seconds. The final piece here that we're going to look at, because again, there's 5 potential elements, but these are the first 3, and you would treat them in the order that we're going through here. With this one, she's going to lack that inferior motion of the sacrum towards her feet. So to check that, I'm going to just take the base of my hand, place it at the top of her sacrum, and rest my palm down upon the rest of her sacrum and gently push towards her feet to take up the slack. And then I've got the little extra push that I give there. That's the spring recoil test. I'm watching her feet. If this motion is in here, it'll translate all the way down to her feet, and I'll see her feet move a little bit. In this case, I do because she's not blocked, but if I push and I don't see any motion down there, it feels pretty much like I'm pushing into a wall. After I've taken up the slack and I do this extra spring, then we know we need to treat that. So if you'll come up onto your hands and knees for just a moment. So for this, we can just take a few pillows, typically 3. This one's a little, I got extra bulk to it, so I have 2 here. So go ahead and lay face down. We're just gonna get her so that their whole pelvis is elevated up off the table. And I'm gonna go back and get that same placement that I did for the assessment. And I'm going to just go to the point of taking up the slack. Once again, not trying to push through the barrier at this point, just taking up the slack. And then I'm going to hold this for 2 minutes in this direction. After the 2 minutes, we'll release and let everything reset for a moment. And then actually we would take her off the pillows and then would recheck at that point. Right, so that's it. That's the recheck. So at that point, I would have seen that I treated all three of these elements of this pattern and can have a lot of confidence that the rest of my treatment, anything else I'm going to do, particularly soft tissue focus, we're going to get better results. So typically this client might have come in without working through these structural dysfunctions first. We may just jump in and start trying to loosen the lumbar and erector area, throughout the posterior hips, quads, hip flexors, and all of that would still make sense for this treatment, but those would best fit in this treatment after having done the structural releases. Okay. So we'll finish there with this description of one of the more common pain patterns that we will see show up into our clinics, and these first three elements of it that we want to treat in order to clear out the pattern there at that deepest cause of micro motion restrictions.